For those shots right now. We are your vaccine authority. Each and every day, we are getting answers to your questions, the questions you're sending us, and we thank you for all of them. Joining us live this afternoon is Dr. Summer McGee. She is the Dean of the School of Health Science at the University of New Haven. Dr. McGee, thank you very much for joining us today.
Thank you for having me.
So let me get right to our first question right here. We've heard a lot about booster shots. So someone is asking, if we need to get a booster shot, when would we need that?
Well, we don't yet know exactly when or how booster shots are likely to take place. Effectively, the two-dose vaccines that everyone has been getting, the Pfizer and the Moderna, is really getting a shot and then getting that booster to get to that high level of immunity. We're still researching and seeing how immunity levels change over time. So hopefully we'll know later this year exactly when and how frequently we're going to need those booster shots. So you don't need it just quite yet.
But the point right now, just get the shot and then we can worry about that down the road, right?
Absolutely. Yeah. Most important thing right now is as soon as you're eligible, get out there and get that vaccine appointment. I know a lot of people are trying right now to get those vaccine appointments. So that's the first step in this process.
Now, Kathy from Wyndham is asking, she said, I had a bad reaction to the swine flu in 1976. Is it safe for me to get a COVID vaccine? If so, which one?
So that's something I think that we have to look very carefully at. CDC recommendations say that if you've had an adverse reaction to a vaccine in the past, any vaccine, that's something you should talk to your doctor and probably your allergist if you have one, or rheumatologist about, to really find out what maybe caused you to have that bad reaction back in the 70s and whether or not that's relevant to what we find and what's in the current COVID vaccines on the market. So I would certainly do some more research, talk to your physician, and then make a calculated judgment based on your risk and your concern about contracting COVID-19, whether the risk of potentially having an allergic reaction may happen if you take one of these vaccines now.
Okay, that's certainly good to know. Now, lastly here, Jean from Groton is asking, how can I get a Johnson & Johnson shot? I don't want the other two. That's what she's asking. I think a lot of people right now are wondering if they can pick their shot. The governor addressed this yesterday. What are your thoughts?
So I really think there's no need to try to pick your shot. I know a lot of folks would prefer the convenience and the ease of getting that one shot vaccine from Johnson & Johnson. But when you look at the data, when you look at all of the evidence, these are three highly effective vaccines that have been through a rigorous vetting process. And so as you're signing up for a vaccine, you're going to get an appointment, you're going to have a location, but you may not know when you show up that day which vaccine is going to be available. But this is not something where we should be waiting to get vaccinated because you want a particular kind or to only have to do one dose. We need everyone to sign up as quickly as possible, get vaccinated, and get that protection so that we can get back to more normal life and activities for everyone.
Well, before I let you go, I have to ask you myself about this Johnson & Johnson. Do you hear from people the opposite? They don't want it because some of the initial reports came out that maybe it wasn't as effective and that may have turned some people off. What are your thoughts?
I think that the minor differences that we see between these three vaccines on the market are really inconsequential. The most important thing is that they prevent serious illness and death, they prevent hospitalizations, and they keep us from getting really sick with COVID-19. And I think that's the most important thing. Those slight differences and the percentages of effectiveness in the big picture are really minimal. And that's why all three of these vaccines are now approved and are being rapidly produced so that we can get those shots in everybody's arms.
Okay. Dr. Summer McGee from the University of New Haven, thank you as always for joining us again this afternoon. We appreciate all your good information.
Thank you.